Presiding Officer. Can I join others in wishing Manager Steve Clark, Captain Andy Robertson, Vice Captain John McGinn and the entire Men's Scotland team all the very best for the Euros, and also wish the Tartan Army a safe and enjoyable visit to Germany. Presiding Officer, before I was elected, I worked in our NHS as a dentist, just one part of our NHS which is currently in crisis. And earlier this week I visited a practice in Fife, and much to their frustration, they can't take any more NHS patients. In fact, 4 out of 5 practices across the country aren't accepting new NHS patients, and more people are being forced to go and pay private. And it's not just dentistry, it's all across our health service, and the problem is growing. The number of people being forced to pay for their own care has gone up 86% since 2019, and are at the highest levels ever. Labour created our NHS to be free at the point of need. Why does that principle not apply under the SNP?
First Minister.
I recognise the challenges that exist within dental practice, but I would point out that Scotland has 57 dentists per 100,000 of the population, compared with 42 in England and 46 in Wales. So the investment that the Government has made in the National Health Service, and particularly in dentistry, is an important contribution to establishing that position and to achieving that position. And it wouldn't have happened had the Government not given that priority since we came to office in 2007. Now, the Government has, of course, undertaken a significant intervention through the introduction of a root and branch reform of the NHS dental payment system in November of last year, and obviously we're in the early days of the implementation of that reform package. So by a combination of the investment in the workforce and the investment in that reform package, the Government is supporting dentistry within Scotland to achieve the necessary delivery of service to people around the country.
Anas Sarwar.
I note the First Minister didn't respond to the fact that 86% increase in people having to go for self-payment because of a lack of access to our NHS. But also the stats that John Swinney quoted will be zero comfort to people who can't access NHS dentistry are being forced to go private. And I think he needs to get his head out of the sand. Labour founded our NHS free at the point of need, open to everyone, regardless of the ability to pay. But under the SNP, people again and again are forced to pay because they can't get treatment in time. Last year, more than 1,500 people were forced to pay for knee replacements at a cost of nearly £16,000 each. 8,000 private operations for cataract, more than £2,800 each. And almost 3,000 hip replacements in Scotland at a cost of more than £14,000 each. So, First Minister, in the middle of a cost of living crisis, when mortgages, energy bills and food prices have all gone up, how much have people had to dig into their own savings or borrow from friends and family in order to pay for their own treatment?
First Minister.
Well, obviously, I regret the fact that people have felt the need to take recourse to private treatment. And I've made clear in my answers over several weeks that the demand on the National Health Service, particularly as a consequence of the increase in caseload because of the cancellation of procedures during the COVID pandemic, has increased the presentation of demand on the National Health Service. And we are working to reduce those waiting times and those waiting lists to ensure that people get treatment at an earlier time than is the case just now. But I do have to say to Anas Sarwar, I think he's on very, very thin ground in challenging me on the question of private involvement in the National Health Service. Let me just remind him of the comments of Labour's Shadow Health Secretary Wes Streeting, who said that a UK Labour government would, and I quote, hold the door wide open for the private sector in the National Health Service. He said also, we will go further than New Labour ever did. I want the NHS to form partnerships with the private sector that goes beyond just hospitals. Now, what we have here is a classic example of what Anas Sarwar gets up to in public debate. He comes here in Scotland and says one thing, and in England his bosses are doing a completely different thing, which will have an effect on our budget here in Scotland. and Anas Sarwar has already been caught out on this week. It's not good enough to say one thing in Scotland and be contradicted by your bosses in London.
Anas Sarwar.
Frankly, that is a frankly embarrassing response to the fact that 3,000 people in Scotland have had to pay £14,000 for a hip replacement. And let me quote, Mr Swinney wants to do quotes, let me quote 2 simple sentences from the UK Labour manifesto published today. Direct response: we saved the NHS before, and the next Labour government will do so again. With Labour, it will always be publicly owned and publicly funded, not more people going private under the SNP. And let me also quote another sentence: there will be no return to austerity. So stop the scaremongering, stop the misinformation, and be truthful with the people across Scotland.
Members.
But I asked John Swinney how much people have had to find from their savings or borrow from friends in order to pay for private treatment, and John Swinney very deliberately failed to answer the question. So let me tell them, just for hip, knee and cataract surgeries in Scotland last year, people had to pay more than £83 million. £83 million. That's what families had to find in the middle of a cost of living crisis because of SNP incompetence. And the SNP's mismanagement of our NHS is so bad that it's those who are in pain, who are sick and who are injured, who are being forced to literally pay the price. But, Presiding Officer, perhaps most horrifyingly of all, there are people who are being forced to go private and pay for their cancer treatment in Scotland. So for all the heckles at the back, this is the reality under this SNP government. Cancer, Scotland's biggest killer, is something that touches us all. Every second wasted in the fight against cancer decreases the chances of survival. Heckling cancer patients having to pay private. Is that the height of the SNP ambition?
Mr Sarwar, I'd be grateful if you could please put a question to the First Minister.
I'm coming right now to the question, Presiding Officer. Last year, more than 1,000
Mr Sarwar, I will allow one further opportunity.
This is my question, Presiding Officer.
I certainly hope it is, Mr Sarwar.
Last year, more than 1,000 rounds of chemotherapy were paid for privately. Why does the First Minister believe people in Scotland should have to pay for their life-saving cancer treatment, 1,000 rounds, because of his party's failure and incompetence?
First Minister.
I don't want anybody to have to pay for cancer treatment in Scotland, but I have to face up to the reality of the challenges facing our National Health Service. Let me just give Mr Sarwar a statistic. The rate of people self-funding for private health care in England is 66% higher than it is in Scotland, and in Labour-run Wales, Jackie Bailey says, but it's the Tories. Well, we'll give Labour-run Wales as a comparison. It's 13% higher in Labour-run Wales than it is in SNP-run Scotland. So perhaps it's not a good idea to heckle me when I'm in mid-flow, Jackie Bailey. Now, you see, what this all comes down to is the financial envelope that's available for the National Health Service. And this government has taken the hard decisions to increase tax, to improve the amount of money that's invested in the National Health Service. Now, there was a day where the Labour Party supported us on that, but now they've deserted the pitch. They've run away. On orders from London, the Labour Party in Scotland is now voting against higher taxes on higher earners in Scotland because they've been told by their bosses in London to do exactly that. That will undermine the investment in our National Health Service, and that is why Anas Sarwar has not a scrap of credibility to tell me that there will be no return to austerity under a Labour government. A Labour government has got to make £20 billion worth of spending cuts to pick up where the Tories have left off. It will be continued austerity from Labour, and Scotland should vote against it.